Good afternoon, and thank you, Cassidy, and the entire core team for the work they are doing to help rural hospitals across our country. The topic, as Cassidy said, for this webinar is applying the quality improvement strategy lean and lean thinking in the healthcare setting. I believe I have about 50 minutes for this presentation. I'll leave about 10 minutes for questions. As Cassidy mentioned, you can ask a question by typing it into the question box. I will do my best to answer each of them once I have finished the presentation. If I don't have the answer today, I'll follow up with your answer once I have researched the question and provide the information back to Cassidy for dissemination to the audience or attending today. Here's our HRSA funding statement disclaimer slide. This webinar is supported by the Health Resources and Services Administration, HRSA, but does not necessarily represent their official views or endorsement. So some of the objectives for the session today is we're going to define the quality improvement strategy lean. We're also going to talk about the 6 principles of lean. We're going to discuss lean thinking, lean management in the healthcare setting. We're going to identify some common challenges to implementing lean, and we're going to discuss one type of lean process called the 5S, and then we're going to evaluate your understanding of lean with just some simple poll questions towards the end of the session. So before we dig deeper into the quality improvement strategy lean, let's briefly talk about continuous quality improvement. CQI, or what it's called by some hospitals, TQM, Total Quality Management, is a requirement of the Centers for Medicare and Medicaid, CMS, conditions of participation, and it's regulation number 482.21. A lot of you that are attending today are probably quality directors or risk managers, so you're probably very familiar with conditions of participation, especially the regulation 482.21. You must not only have a CQI or a TQM program, but it must be facility-wide and approved by your hospital board. QAPI, standing for Quality Assessment Process Improvement, is another one of the CMS mandates to make sure your quality improvement programs are implementing appropriate performance improvement projects. Your team should have valid and reliable data revealing if the area of concern for the performance improvement project is 1, problem-prone, frequent, and high in volume. You want to make sure you're not expending resources and time of your staff on performance improvement projects that you don't see quite frequently there at your facility. So this is in place to help facilities use the appropriate resources in areas of greatest concern. And remember to be careful to always include your near misses when you're studying what needs improvement. When working your QI plan or program, you want to make sure you teach QI fundamentals system-wide and share what your teams learn system-wide. Keep an open mind to change, and remember you can't improve what you don't know, so you need to have data to show what you need to do the next time you don't meet an outcome and have to improve your process. You want to focus on process and systems and sub-processes and try not to focus on people. You want to seek simple solutions whenever possible. Stop and address the problem when it first occurs, and acknowledge problems or opportunities or what we call gold nuggets. You want to stay away from the blame and shame game, and you want to encourage others to be part of the solution. You want to make sure your frontline staff that are working the process or the program also are the ones that are helping to become part of the solution, and it's not just top down. Quality improvement is continuous. There's no final destination on the quality improvement journey. Now that we've defined continuous quality improvement and how to implement CQI, what do you mean when you say quality improvement strategies? So this slide just shows a very basic, simple definition of a quality improvement strategy, and it's defined as any intervention aimed at reducing the quality gap for a group of patients representative of those encountered in routine practice. Now, when we say group of patients, that also encompasses everybody that's working with those patients. Many strategies and tools for quality improvement can be accessed through all of the different types of web access that you have on the internet. Some of the better ones are your AHRQ website, and also your IHI, National Patient Safety Foundation websites. There's just so many tools out there for you to access when you're looking up quality improvement tools and strategies. Lots of good templates to use, and also includes what we're going to talk about today. So we're going to review the QI strategy Lean, and Lean usually goes hand in hand with Six Sigma, but today we're going to talk about Lean independent of Six Sigma. Maybe down the road in future webinars, we'll have the opportunity to talk to you about Six Sigma and how you use that in healthcare. What is Lean? We're going to talk about 6 principles of Lean and how to apply them. We're going to discuss Lean thinking and look at one Lean process called the 5S. And the 5S is going to be used in various ways. You can use it system-wide or department, at a department level, or even at a personal level to lean out some of the non-value things that you're going to be doing. All right, 6 principles of Lean. Let's go ahead and get started on those. Principle number 1, this is an attitude of continuous improvement. And I just, again, can't emphasize talking about quality improvement as continuous improvement. It never stops evolving. It never stops improving. Shewhart, the grandfather of continuous quality improvement, and his student W. Edwards Deming moved the Lean thinking along to include other tools, quality improvement tools, such as the PDSA, which stands for Plan, Do, Study, and Act. That is a central tenet of Lean. So we're going to talk about using the Lean tool and strategy, and at the same time, talk about how you can use PDSA, another tool to help you lean out your processes. So generally speaking, the PDSA approach is a scientific method to apply to your daily work. So you're going to define a hypothesis on how a process can be improved. You're going to test that hypothesis, and if an improvement occurs, you're going to make the improvement standard work until there is a need for further improvement. So you want to sustain all your gains. This encompasses the attitude, again, of continuous quality improvement. For Lean to be implemented in your organization and transform the culture to one of continuous quality improvement, this is the kicker, and this is what's the hardest thing to do. Management must let go of the role of problem solver and allow those closer to the problem and those that benefit the most to have the hands-on experience in using Lean methods. When I talk about that, and we'll talk about it again in a few minutes, one of the biggest challenges and barriers for a system or an independent hospital or even a department to implement Lean thinking and Lean change is that idea of letting go. It's really easier for the hierarchy to be top down and have the people that are in an authority position making decisions be the ones to drive Lean, and that is not what we want. We want Lean to be driven by those that are actually working the work, and we want them to be part of the solution. So remember that and keep that in the back of your mind as we go through this. Clinical and non-clinical staff are given encouragement, training, and time to make meaningful improvements will help your overall organization to raise the bar and become increasingly innovative and sustain an attitude of continuous quality improvement. When you think about Lean, you must also think about the other strategies as complementary tools to develop a Lean healthcare system. So principle number 2 is value creating. So the underlying goal of Lean in healthcare is to improve value for your patients and for your patients' caregivers. This value extends to the healthcare team, as we talked about a few minutes ago. It's not just about the patient. It's your healthcare team and other stakeholders. Value is created by reducing error and improving response times and other measurable, again, it must be measurable, you have to have data, benefits for both the patient and the healthcare team. The goal for creating value is to increase benefits while you're decreasing burdens. So when you think of the triple aim, you think about improving care when you're decreasing costs. This is going along that same line of thinking. Increase your benefits and decrease your burdens. A principal Lean tool to visualize this is something called a value stream map, and we're going to show you examples of that in a few minutes. This map shows specific steps in a process that do or do not contribute value. This type of mapping includes information flow, material, and people flow to allow the team to more clearly see the current state and begin to see a roadmap to improvement. So your team members will ask, well, why do we do this step? Is there a more efficient or an alternative or an effective alternative to get to where we need to be? So that's why you need your team members involved in the lean. They're the ones that are working these steps, and they know which ones are valuable and which ones aren't. Which steps are vulnerable to error? That's also very important. We talk about handoffs, patient handoffs. To do this type of mapping, you must pay attention to detail. If the team is effective, a process that has 100 steps most likely will be reduced due to careful studying of creating value for the patient and the healthcare team. Principle number 3, lean is unity of purpose. And I always say that this is one of the hardest principles in lean. With most healthcare organizations being very complex systems sometimes, it can be difficult for staff to know what tasks carry the greatest importance. If lean is properly executed within your organization, it clarifies priorities and provides guidance to staff in improving work accordingly. So if you have a lean senior manager whose role is to prioritize and clearly communicate a small number of strategic goals that are relevant throughout the organization and have the greatest chance to strengthen the organization, you definitely want to make sure that that senior manager knows what he or she is talking about. The improvement projects selected by the healthcare team should fit within this strategic framework. Again, we go back to what we said a few minutes ago about QAPI with CMS conditions of participation. Make sure that you're not doing anything outside of what your goal and mission is for your institution or for your department. The projects are the how, and they move the healthcare team forward when you're prioritizing your goal, which is the what. You can use things like rapid cycle improvement teams when you're implementing lean, especially when you're talking about unity of purpose and you're talking about how to execute within your organization. Rapid cycle teams are just takes bite-sized information and move them through the system quite quickly. Principle number 4 is respect for the people who do the work. The principle is probably the most difficult to manage and can be a big deal breaker for some organizations. We've heard from organizations in the past that said they just could not do that lean thing because it's hard to allow the people who do the work to be part of the solution. Many organizations still use that top-down approach with senior management and supervisors telling lower-level staff what to do and how to do it, even if they are not involved in the daily work. Lean truly upsets the apple cart and turns this type of leadership and management upside down. One of the things that you're going to have to do before you decide to have a lean institution or a lean department, you're going to have to do an assessment of your staff and of your administration and see if they are the ones that's going to provide you the backbone and the support to do this type of change. The senior leaders must have the respect, as I said, for the frontline staff, and management should make special efforts to create a very safe environment for not only innovation, but also allowing others to no longer blame individuals should something not succeed, but determine that when it fails, it's an opportunity for improvement. This will allow your staff to report problems without the fear of judgment. This is key when we're talking about this principle, respect for what people do. Most lean organizations commit to retain or retrain employees that may be let go based on improving your efficiency and your overall productivity. So this is really tough for an organization to take on. When we talk about small hospitals and rural hospitals, you know, we want more. We talk about how we need more patients, we need more staff. In this particular example, and when you're using lean, you're actually going to eliminate waste. And so when you have staff that's not as productive in certain areas, not because they're just not productive people, but they're not needed in that area, you would hope that your administrative staff or your supporting staff will be able to train them in some other area where you see that you don't have enough of. So you're just moving resources around and trying to keep your staff, but making sure that they're using their resources along with your resources to be more productive. Staff should always remember respect flows downward and upward in a lean organization. So principle 5 of lean is a visual principle. Visual tracking centers are paramount and should be numerous in your lean organization. So a tracking center is an information display mounted on the walls for staff-only areas and should contain performance data on key metrics. For example, you might want to track your HCAP data, your patient satisfaction data and quality measures. This also enables your staff to have a dedicated space to communicate issues that need attention or post-improvement ideas. Staff can also provide updates on projects and timelines that they're working for you, or they can post when they want to have an ad hoc meeting to address work in progress. So when you have these visual centers, the phrase that's used quite a bit in the quality improvement arena around lean is called working the wall. When you work the wall, you're taking your organization, your staff, and your leaders, and you're standing in front of one of these tracking centers, discussing and referencing the posted information. So for example, if one of your tracking centers has your HCAP data, you may want to meet there once a week or more frequently, have the key people that need to meet there join together and talk about where you have some kudos, where you're doing well in your 27 questions for HCAPs, and where you're doing poorly or where you need some improvement. Again, this is leaning out that the area of HCAPs and quality measures. And so when you look at those tracking stations and you see all of that data and it's kept up to date, you have the key individuals there that can make a difference in your HCAPS data and help you lean out some of the different processes and resources you have to make sure that you're more favorable with your HCAP numbers. One of the things you want to make sure is your information is dynamic and directly relates to what staff are thinking about in terms of what is best to provide patient satisfaction and process improvement. So when you're doing this, you should make sure you never become stale. It's never status quo. Your bulletin board should always change. One of the tools that we like to use a lot is sticky notes. And so you're going to see on this next slide a very, very, very simple visual tracking center that's placed on the wall or in a room. You can use whiteboards, you can use steno tablets, whatever works for your facility and whatever you can afford. But again, it's really nice to have sticky notes and things that you can move around. Whatever fits best for your facility can be as simple as what you see on this slide. The tools you use do not have to be expensive. The value is placed on the effectiveness of this visual center and if you're getting your message across. So remember, it's more about the content than what you're displaying as far as being something really nice. This next one now is more resource intensive. It's more complex. This tracking center is very data driven. You probably can't see this very well. I took this from a different picture that was being used by a system. Whatever you do, be sure your information is up to date and accurate. So even when you're using these type of complex tracking boards, for whether it's for manufacturing or for healthcare, if you don't keep it up to date, you're going to lose the trust of your healthcare teams and administration if you display old data or inaccurate data. We always talk about websites. It's the most frustrating thing is to go to a website and see old data or see old information from a year ago or see old calendars or events that are no longer things that you can enjoy or go to. So we want to make sure your visual tracking centers are the same way. They're kept up to date no matter how complex they are. We talked about information also changing, so don't get hung up on putting too much time into something that is so very pleasing to the eye, but will change every month. So if you spend a lot of time and resources on your tracking center, you're actually going away from what we're talking about today, and that's leaning out a process. You're spending too much time in an area that doesn't make a lot of sense. Don't forget the concept of working the wall, having your teams huddle routinely in front of these displays to talk about the next steps towards improvement, no matter what you're displaying. So I'm going to move over to value stream maps. And this slide shows you, again, another visual. This is a visual of the steps to create a value stream map, and it's as simple as the title. You're looking at value and non-value. You're going to take away the non-value and you're going to keep the value. Teams should always map out a current state map to provide a baseline and to identify areas for improvement. So you want to look at what you're doing now, how you can improve and what you need to do in the future. So step one is to draw your current state of your process, or current state of your department, or current state of your facility. Step two is to look at the value add and the non-value add steps and times for each step. Step three is determine areas of improvement and realistic solutions. Again, I say realistic. You want to make sure you stay within what you can and cannot do. Step four is to draw a future state value stream map based on the improvements determined by the team from the current map. Step five is to implement, and step six is to measure success or lack thereof. Again, remember, quality is continuous, so you're going to need to reevaluate each step of your process and your final outcomes of your value stream map. I put an example on this particular slide. We're going to talk through this. So as an example of value stream mapping in healthcare, this is mapping a patient's path to treatment to improve service, patient satisfaction, and minimize delay. So how many times would you like to map out when a patient comes to your ER for a particular test or treatment, and look how long they stay either in the ER or maybe over at the doctor's office before they even get to your hospital? Remember to accurately map a system, obtaining accurate data about the flow. If you're timing your steps, make sure you use multi-departmental teams. This is just key to obtain a true picture of the process and the actual time it takes for each step. When looking for areas of improvement, try to focus on changes to improve the flow of patients throughout the process. So continuous flow is ideal. This type of flow moves patients through the process without having any waiting times. Once you have completed the current and future state maps, the team should compare the two and identify opportunities for improvement with subsequent steps to implement change. So if we're looking at this pathway, you see you're in the physician's office, you get to the hospital, you're in registration, you go through triage, you get the treatment, and you're discharged. When you look at the current state, like we just said, the current state of the value stream map, it's 330 minutes, 5.5 hours. When you study this and you look at the valuable time after leaning out a process, it drops down. 130 minutes dropped off to 200 minutes. So this shows how you have your current time of 40 minutes with your physician. The VA stands for the value add and the non-value add. So when this team studied this process, they determined that they could cut it in half, 20 and 20, keep 20 minutes, reduce 20 minutes based on the task at the physician's office. And you just go through the process. For the time in the hospital, look how much time when you get to the hospital, 140 minutes. Of that 140 minutes, when they had an interdisciplinary team study this, they only had 10 minutes of value. There was 130 minutes of non-value. That's key. When you looked at registration, 5 value, 10 non-value. Again, triage was cut in half by 15 minutes. Treatment, 35 minutes, so that you want more time in your treatment. And then discharge, look at that. 45 minutes for discharge was valuable, 15 not. So when you look at this current state map, you can see where all of the resources are going and where all the non-valuable time is, and that's when you get to the hospital. So there's sub-processes within this process to study when you go through this. So let's talk about the principles of lean, the 6 principles that we talked about in the objectives. Lean is flexible regimentation, so principle number 6. I'm sure those of you that have been working in quality improvement have often heard the phrase, processes are perfectly designed to produce the results that occur. In a lean facility, that may not be enough. You cannot go by that particular phrase. What if the results are not optimum? That's what you have to study. The key to improvement is to determine the root cause of performance shortfalls and determine if process redesign is warranted. So that's why it's called flexible regimentation. This is essence to lean. You have to be able to flex and make some changes if you determine that the changes are appropriate. Take non-standard work processes and transform them into standard processes that improve performance, and then continue to improve the standard work through the use of PDSA. As I talked about earlier, the Plan, Do, Study Act is going to be used interchangeably through working to lean out your facility or your department. Regimentation refers to developing a standard process for specific purposes, but has to be flexible enough to refer to ongoing efforts to improve the standard or process. Again, I can't say this enough, and you're going to hear this throughout the presentation. This is exactly what we call continuous quality improvement and what CQI means. So an example, your healthcare team has worked tirelessly to improve a particular form or protocol you are using at your facility. You've provided extensive training, and you're past the pilot stage of using this form. It is successful, and you're meeting your metrics based on the design of this new form. Now, a quality measure has changed, like it usually does once you get it down, and the form now is no longer useful for this particular area, for this particular design for that metric. Your team must be on top of this new change and be flexible enough to redesign, including education on the standard process you had implemented months ago. However, stay lean and don't change what is working. Make sure you keep what is working and change what is absolutely necessary. Again, you're doing your non-value add. Lean thinking. For those 6 principles, we want to make sure that we talk about lean thinking. Deming, as I talked about earlier, W. Edwards Deming was one of the main philosophers that studied quality improvement. He talked about lean thinking through manufacturing, and then of course it went over into healthcare. So this stems from deep quality improvement metrics in manufacturing. When we talk about lean thinking, we talk about driving out waste so that all work adds value and serves the customer's need. So we're looking at our internal customers, and we're looking at our external customers. We want to identify value add and non-value add steps, as we talked about a few minutes ago, in every part of our process. It's the beginning of our journey towards lean operations. This next statement is very key. In order for lean principles to take root, our leaders must first work to create an organizational culture that is receptive to lean thinking. When all are on board, lean principles can have a positive impact on productivity, cost, quality, and timely delivery of your care services. So it doesn't matter whether you're in manufacturing or in healthcare. If you don't have everybody on board from your administration all the way down, you can't implement these lean principles, and you definitely can't be positive towards your productivity and your cost and quality. All this together with a target goal of improved patient care outcomes and reduce cost and waste is lean thinking. Lean principles have been used effectively in manufacturing companies for decades, particularly in Japan. I'm going to give you a little bit of history here. The Institute for Healthcare Improvement, IHI, believes that lean principles can be and are already very successful being applied to the delivery of optimal healthcare, which is why we're talking about it today. So what is meant by lean thinking or lean management? Simply put, lean means using less to do more. Lean thinking is a management strategy that is applicable to all organizations because it has to do with improving processes. All organizations, including healthcare organizations, are composed of a series of processes to create value for those who use and depend upon them. And so we're talking about our customers, our patients, our healthcare teams, internal and external customers. In Japan, the word for waste is called muda, M-U-D-A. To maximize value and eliminate waste, healthcare teams must evaluate processes by determining the value in every step of the process. Again, I'm talking about the value streaming. We just showed an example of how to do value stream maps. And you must eliminate the non-value added steps based on data, based on studying those processes by your interdisciplinary team. Quality guru Deming taught this, among other things. Managers should stop depending on mass inspection to achieve quality and instead focus on improving processes and sub-processes and building quality into each step of your process to deliver optimal products and outcomes. In our case, optimal patient care health outcomes. So some of the key concepts in lean thinking, when it comes to applying the concepts of lean thinking, it can be somewhat difficult to leadership due to their traditional role of top-down. Leaders are put into this leadership role based on their ability to lead and get it right. Well, with lean thinking, that is still true. However, they must be willing to allow others, those that work the product and work the outcome and work the process, to be visible and vocal with their presentation of ideas. How many times have you been in a meeting with administration and you can be visible, but you just cannot be vocal? They must be the type of leader who encourages others to show out their ideas in a professional but very respectful manner. To do this, they must create a safe environment for their teams, allow them to fail without punitive actions. As we know in quality, we learn many things from our failures, so we now call them, again, opportunities or gold nuggets. Additionally, leadership must be committed to support these efforts and see them through in an effort to successfully implement lean in their facilities, within their departments, and even within their individual staff to make sure that they are leaning out what they need to do. So some key concepts, again, in lean thinking. Lean thinking creates a different type of culture. This culture is built on less, not more. So less is more, and what I mean by that is that we as healthcare professionals must determine what types of lean tools we will use to get to the core of what we're trying to accomplish. We're going to remove waste. We're going to remove non-value added work. We're going to remove processes and sub-processes that we don't need, and we're going to build upon value add activities to ultimately reach our stated outcome goals. Removing work and processes are definitely different from the traditional business culture. So let's review traditional culture versus lean culture. This slide shows you on the one side your traditional culture and then your lean culture. An organization's culture is the set of values and beliefs that's caused people to believe in certain ways. And so that's just how our belief system is set up. One of the challenges in implementing lean in healthcare is that it requires people to not only identify waste, but they have to identify waste in the work in which they are so invested. Again, we go back to what I said earlier. This may come to the point where you have to look at jobs sometimes, or whether or not you're going to invest in equipment versus personnel. Depends on what you've studied. All workers want to feel their work is valuable. Perhaps most, especially healthcare workers, recognizing that much about their daily task is wasteful and does not add value can be very difficult for a healthcare professional, especially those who have been doing the same thing for a long time. A nurse who is hunting for supplies is doing it to serve the needs of our patients, right? But nurses may not see this as wasted time and may not stop to wonder why these supplies aren't where they need to be every time they need them. But if the supplies were always readily available, the times nurse spent hunting for them would instead be devoted to something more appropriate to their skills and expertise. So when you read some of these bullets on the traditional versus the lean culture, interdisciplinary team is always key. You never want to work in silos. And then if you go down on the blame people versus a root cause analysis, I think most of our hospitals now work with root cause analysis and know the concept of not doing the blame and shame and drilling down on processes and sub-processes instead of identifying people as the problem. And then also we want to make sure that we share information. In the traditional culture, we guarded our information. A lot of hospitals didn't want to release their data, but now I believe with core measurement, the different types of venues that we have with EHRs, ECQM, a lot of the different things that we do where we have to share information, hospital compare websites, we don't guard our information as much as we used to. The only way we learn is to learn from data, so sharing is key. Team focus is also very key versus the traditional culture of individual focus. So on process is a set of actions or steps. So when you're looking at your process, each step of which must be accomplished properly in the proper sequence at the proper time to create value for a customer or a patient. Some of the other tools that can be used when you're leaning out is something called healthcare failure mode effect analysis, which is where you're looking at your sub-processes within a process and seeing where potential error can happen. While you're looking at those sub-processes for potential error, that's where you're also going to lean out some of those sub-processes because they're not useful anymore. The goal is to create a perfect process if that's possible. A perfect process creates precisely the right value for the customer or the patient. Every step is valuable, creating value for your patient. Capable produces a good result every time. Available does not cause delay. Flexible and linked for continuous flow. We talked about continuous quality improvement and continuous flow to make sure that your process is as lean as possible. Failure in any of these areas or any of these dimensions produce some type of waste. A perfect process not only creates value, but is also satisfying for people to perform that process, and managers to manage and patients to experience. One very specific type of lean process solution is the 5S, and that's probably one of the most common lean processes that's used. So I'm going to show you a very short video clip on the 5S process and how it's used in learning leaning out a hospital supply room. So we're going to show you a video. Hopefully you can hear it okay and see it okay, and we'll talk about it in just a moment. Yes. Some information back, Cassidy did through the chat box, that you could not see that video, which I'm sorry that you couldn't see that. It was a really good video on talking about lean and how to lean out a supply room for this particular hospital and the nurses. So when we talk about lean and we talk about the 5S, the 5S stands for sort, straighten, sweep, standardize, and sustain. This is really important when you're going through your lean process to use something like the 5S lean because it keeps you more focused on what you're doing. You see on this particular graph, and I was just going to recap after the video, that there's many tools that can help hospitals with the lean process. Many healthcare teams utilize this 5S solution to support their implementation of simple production and continuous quality improvement. By following the 5 steps, a facility can create a well-ordered environment where employees can move from one workstation to another without having to spend time learning new layouts. With the 5S, you're going to start with, you're going to sort, you're going to set an order, which means simplify. The third one is called shine or sweep. So you're going to remove what is wasteful, and then you're going to standardize, and then you're going to sustain. So you want to make sure that whatever you do with the 5S process, it's going to be sustainable. So once you standardize the process, you have to work on a plan on how you can sustain that lean improvement. So I have a couple poll questions. Hopefully this will work with y'all since we didn't get the video. So we're going to test your understanding. It's very simple poll questions. Cassie's going to go ahead and pull the polls up and give you a few seconds to answer them. Have the first one. I'm pulling up. They're starting to come in. So this slide, as she is pulling up these questions on these slides, one of the questions was maximizing customer value while minimizing waste is one of the definitions of lean. That's a true or false question. And it looks like, when I'm looking at what you guys have turned in, very good, 100% got that one right. The answer is true. Value mapping should only be done by senior managers. Is that true or false? And it looks like the biggest percentage of y'all said false, and that is correct. And then the last one, question number 3, sort, set in order, shine, standardize, and sustain are known as what? And it looks like there's a combination. And if you said 5S or all of the above, both of those answers could be used because it is a way to eliminate waste. It is a lean best practice, and it does stand for 5S. So that's good to see that most of you answered all those 3 simple questions almost 100% correctly. So in conclusion, lean is an innovative management approach that has proven successful in healthcare organizations. It offers promise for improving quality and efficiency while controlling cost and the provision of optimum patient care. To implement the lean philosophy and principles, however, is to undertake an arduous, never-ending improvement journey. Because lean transforms organizational culture from the inside out, it offers both challenges and opportunities. It requires a major shift in your roles for managers and leaders. They must become now facilitators, mentors, and teachers, and allow your frontline workers to make the improvements. It engages the entire staff in identifying and solving problems based on a continuous quality improvement attitude. The driving force behind lean work is continuous quality improvement. The undergoing goal of lean is to improve value for the patients. So I'm going to turn this back over to Cassidy to see if we have any questions about the presentation today. Cassidy?
Okay, thanks. So if you have a question, please feel free to type it into the chat box. We will hang out for just a few seconds or a few minutes while you guys take the time to do that. I also shared in our chat the survey for this webinar. Feel free to take that now or later. It will also come out in the webinar or the email following this webinar. Okay, so it looks like we may have a couple of things in chat. Let's see. So someone's asking, could you please go back to the 5S slide?
Sure. We have that back up, I think, there. Yeah, was there a specific question?
Yeah, there's no statement here, but Melody, if you want to elaborate or if you have a question about the 5S slide, you can go ahead and ask that. Someone did ask if these PowerPoint slides will be shared. We don't attach anything in the email that goes out. We share the link for the recording, but I can definitely send you the slide deck.
So I don't know if there was a specific question about the 5S slide, or if you just wanted to see it. As you see, they all start with the S. And so when you're looking at your maybe a station or even looking at your department or your facility wide, depending on what you're trying to lean out, you want to make sure that it's systemic, whatever you're doing. When it talks about sort, it means just like if you're going through your clothes, I'll use that as an example. You're going to look at what's valuable and what's not valuable. So when you're doing your value stream maps, you're actually sorting. You're determining what you're going to keep and what you're not going to keep. Simplify, so that's what's called set in order. So you make it simple. You take out those steps that are not productive, whether it's, like I said, cleaning a supply closet. I hate that you didn't see the video because it was a really nice video showing how they changed a supply room. So you're going to make it very simple so that when you take the steps to either do a process, do a task, get a supply, even taking a patient through a process flow, you want to keep it as simple as possible, not only to reduce error because of handoffs, but make it more timely and efficient. Sweep, again, is the same thing. Whatever you determine is not going to be used after you did your sort and simplify, you sweep it away, or called shine. It's no longer useful to you, so you don't keep it in your process any longer. And then whatever you determine with that process, when you leaned it out, you make it standardized. And what that means, it's standard for everybody using it. So if it's too complicated for a particular set of users, make it more standard for them so that everybody can go through that process the way you want them to go through it. And then sustain. Sustain means that you keep it going. If it's something that's very valuable and it's been more efficient to lean that process out, collect data on it to show how it's improved your outcomes, and then also determine there at your facility how to sustain that process until it's time to change it. Any other questions?
Great. I don't see any questions in the queue at this time, but we do still have a few minutes left before the end of the hour. If anyone has any additional questions or would like more details on any of the slides, you can ask in chat, or you should be able to unmute yourself and ask it verbally over the phone. So we'll just wait just a couple more minutes and let anyone who might be thinking about a question go ahead and type it. Okay, we have another question in the chat. Where is lean training offered?
So lean training as a quality improvement strategy is offered all over the country. Some of the websites that I've mentioned earlier that you can go to see if there's classes is HRSA. You can go to your AHRQ website or your IHI website. The Patient Safety, National Patient Safety Foundation within IHI now does a lot of training for quality improvement tools and strategies. There's a lot of templates. I mentioned the PDSA template. You can pull those templates down from these different sites. They also have video clips. As a matter of fact, most of my video clips that I use come from these different sites. And then they offer calendars. Again, some of it's outdated, which we don't like to talk about when we're talking about Teach and Lean, but they do offer calendar of events, and you can see if there's anything close in your area. In Texas, Texas is so big, usually anything that's done through training is going to be done through Houston, Austin, or Dallas. I can look up if we know who this particular individual is to see if there's some lean training coming up around that area if you let us know where you're at.
Okay. Carissa, I believe you asked the question. So if you just want to let us know, you can private message me in chat or share with everyone. Just let us know the state you're in and we'll follow up with you. We do have another question in the chat. For a team just starting their lean journey, what is the first step or activity that you would do with them?
The very first thing I would do is spend a significant amount of time on orientation about the process and talking to our people that are our administrators. That's going to have to be the ones to support you, to even see if they'll allow you through their support to do lean appropriately. If you don't have the support of your administrative staff or those that can make the decisions for you at your facility, the journey is not going to be a good journey. You're going to be butting heads. You're going to be running into roadblocks. It's very important with lean change management is that you have a institute that has a culture of safety and a culture of promoting interdisciplinary work and working more at a horizontal level instead of a top-down. So I would spend most of my time in the very beginning, set up maybe a couple huddles or meetings and bring in your admin staff, your CEO, whoever's going to be in charge of saying, yes, let's do this, along with your support staff, and then maybe bringing in a few of your workers that are actually out there in the front line or on the front line doing the work. Go over lean and make sure it's a possibility there for your institute, because this process, this strategy is very inexpensive. It's if you use your time wisely and train and educate before you get started and know going forward from the very beginning that you're going to be reducing things there at your facility or within your department, you're going to find that your outcome is going to be better if you know that up front. So that's where I would start.
Great, thank you. Okay, there are a few minutes left if anyone has any other questions before we close. Okay, so we're going to go ahead and wrap up. We would like to sincerely thank Tammy Wagner for an excellent presentation, and thank you to everyone on the call and for your excellent questions. You can be looking for the follow-up email. It will most likely come out to you on Monday, as it takes a couple of days to get these webinars posted to our site and get that link available for you. But when that email comes, you will have the opportunity to take the survey, which you also have in the chat. If you want to click on that real quick, it takes about 60 seconds. We value your feedback. It also helps us select future webinars. So if you have any suggestions or topics you would like to see a webinar on, let us know. We would love to hear from you. You will also be able to register for upcoming webinars. So with that, we will go ahead and close. Thank you everyone again, and have a great afternoon.